Hello, thank you for tuning in to Brownstone's Farm Informative Page. My name is Natalie Unger. I am the owner-operator of Brownstone Farm. We're going to talk today about some basically different things that people might need in their farm. First, we're going to talk about HYPP, and I'm sure that a lot of you have heard of this, but most of you have never experienced it. HYPP is basically a potassium overdose in the muscles that they cannot push out. They have receptors, more receptors coming in than what they have going out. So basically they back up and tie up in those muscles. And yes, they can tie up in their heart. Yes, they can tie up in their kidneys and cause them, basically they can pass out. Now, if you look at your horse, if they're impressive bred and you're looking at your horse and their muscles are all quivering all over, it basically looks like the ocean. Their skin is waving. Their eyelids, their third eyelid is rolling up over their eye, and they're kind of looking like they're going to pass out on you, or literally do pass out. This is how we treat this. First and foremost, do not panic when they go down. The horse is already upset that this is happening. You are what they need to rely on to calm them back down. What I want you to do is run for this product, KO syrup, and Banamine. You will give 60 cc's of KO syrup. You will give 2 scoops of this and 5 cc's of Banamine. They will all be given in their mouth. Make sure that you tilt their head up, even if they are passed out. Their mouth will absorb all this. They will then intake it. In about approximately 15 to 20 minutes, you will watch them slowly come around and recover. At that point, please do not panic while they're going through that. Allow them to relax. Don't try and get them up. They will do that all on their own. Once they start to get up, then go ahead and encourage them to stand and relax. Pet them. Let them know everything's good. Most of the time when they'll stand up, they'll and whinny at you. These are all things to look for, but constantly, do not panic through all this. And that will take care of your HYPP. Now, I have a horse with creeping crud. Now, creeping crud is basically a bacterial infection that gets underneath their skin. What happens with that is it's really dry outside. The horse has powdered dust under their legs, and we haven't really been out the night before to clean them up. They're out on wet grass the next day. That wet grass forms a bubble over top of that skin where all that dirt is underneath. That infection will start underneath there, and it will start to look scabby and pick all up, and they'll start to look dinosaur-y through there. A lot of people have it, creeping crud, in the front of their hind cannon bones and don't realize that's what they have. With this, what I'd like you to do is pull them in, wash it very, very good with Novelsin. Try and get as many scabs off as you possibly can at that point, and most of them will not come off, so don't panic. Just try and get them as clean as possible. And this is extremely painful for these horses. So they are very, very negative about you doing this to them. So please be very careful when you do it. Also, try not to pick off too many scabs. They will bleed. This is part of it. After you've got them cleaned up with the Novelsin, I want you to pat it dry and make sure it is very dry. Keeping in mind, bacteria reproduces in damp, wet areas. We want to dry it off. After you have it dry, take Tomorrow. This basically is bag balm for cattle, but it has antibiotic in it. Take that and smear it all through it. You treat that every day for 2 or 3 days, and you will find it will come completely clean in approximately a week. Do not use things that moisturize it. You will find that it will take you twice as long. There are people say wash it every day. I do not wash them every day. I do not want that damp or wet. I want to pull that moisture out and start to kill the area where the bacteria can grow. Next, we're going to discuss basically Thrush. Thrush is so much similar to what we just discussed about. Thrush is also another bacteria that gets down in between the clefts of the feet. some to the point where it gets deep enough that they bleed. Now, anybody who does not know what the cleft is, it's in between the balls of the heel. It's where it drops down into the frog and down both sides of the frog. Those are the clefts of the foot. What you're going to do is clean that all off. And once again, the first time you can wash it with Novelson. Clean it out very, very good. After you're finished, pat it dry, make sure it's dry. We also use the product Tomorrow in that. We will actually put that tube down in there as far as it goes, push that in until it starts to come out the top. You will be surprised, in a week, your thrush will be taken care of. They do make other products, Thrush Buster, and there's all kinds of different thrush products. Most of those are moisture based. They'll kill the outside, but it doesn't go to the inside because the moisture from those products, once they're done using, will reproduce that thrush, that bacteria in there. The Tomorrow has antibiotic in it, and it takes care of it almost instantaneously. It's a tremendous, tremendous product. And that will take care of your thrush. All right, if they by chance are very, very sore on it, you can use Butte, you can use Banamine. Let's say I have a horse that is very, very sore for me, that I overrode them. They have, their hind muscle is sore, their gaskin is sore, something like that. We use a product called Surpass. We will rub that in. It's a lot like Bengay for anybody who has understanding of that. Use that a couple of days, probably approximately a week, just rubbing it into that area, and it usually does a really, really, really good job. Another product we use is Gastroguard. I have a horse that has been through a lot of stress, moving around a lot. Horses that worry a lot, they get stomach ulcers. I will use this product called Gastroguard. You use a whole tube for 7 days. After that, 7 tubes of it, half a tube at a time. And that should pretty much take care of that. Now, you can have the vet come out and you can have them go down through and scope them and check them out. I have found that it's not always necessary. You can go ahead and use that even if it's just light, and that'll help take care of any kind of intestinal problems that you might have. Anytime it gets dry and dusty, everybody should know that our tear duct in our horse starts up underneath the base of your nose. When you look up your horse's nostril to the inside wall along the main bone coming down, you will find a little hole in there if you look up far enough. That is the tear duct that comes out of your horse's eyes. So when it's dry outside, they're outside chewing and blowing and pulling dust up into their nose constantly, thus pulling dirt and dust up into their eye or tear duct. With that said, they could have some allergies with it. We use this product. Please make sure that you do not touch your finger to the tube. That will contaminate your whole tube. Let it drop into your finger. Take that and put it into your horse's eye, and you can use that without any problem. We usually do that 1 or 2 times, and that will clear that up after 1 or 2 days. Now, let's say I have a horse that I'm having issues with being sore. I always keep Equiox around. Why do I keep that around? It is less severe on my horse's stomach than Butte. And I might have, maybe I overrode my horse. Maybe they're getting a little older and they're in their 20s and they're just not working like they used to, and they're a little sore in the morning when they come out. 1 tablet of Equiox, and you could use that for approximately 7 days, along with some of your Surpass. And that will really, really help that older horse get through that soreness and stiffness. I also will always keep syringes to help me clean out cuts. This will be to put my Banamine in my horse's mouth. I always use Banamine. It is cheaper to buy it that way than what it is to buy in the tube. You draw it out and you actually put it into your horse's mouth. If they're not too bad, you give 5 cc's. If they're very, very sore, or you're dealing with some kind of a stomach issue, colic or something like that, we will use 10 cc's. Now, I'm careful to talk about the colic. Colic can be very, very fussy and funny. If a horse is truly, truly having a problem, such as a twisted intestine, which none of us want to hear about, or they have some kind of a tumor or something in there that is really causing them, giving them an issue and blocking off, the pain will fight through that Banamine. So if you give your horse Banamine and in half an hour they are not feeling better, they are getting worse, do not wait, do not hesitate, get a vet on the phone. you have a bigger problem. If they are feeling better with the Banamine, you're just dealing with something they might have eaten that is not agreeing with them, or they have a light blockage from not drinking enough water. Maybe you rode them extra hard and they didn't get enough water. There's all different kind of things that can cause a horse to dehydrate, just as us. So it's just a dehydration problem. The Banamine will take care of that. And again, thank you very much for checking in to the Brownstone Farm website. Stay tuned for some of our next informative videos.